there, this is Heather Estes, and I'm the CEO of Planned Parenthood Shasta Diablo. This is an overview of electronic health records and the implementation that we are planning of electronic health records. The reason why we're doing this is because it is excellent for quality care, but there's also some pretty practical reasons. We really don't have a choice. We have a choice about when, but we don't really have a choice of doing it. President Obama is quite clear that we and everyone else in the healthcare system in the United States needs to go to electronic health records sooner or later.
Hi, I'm Jeff Waldman, Medical Director for Planned Parenthood Shasta Diablo. It's going to be a pretty exciting change for us. It's going to be, I think, an enormous amount of work, and you've already put in an enormous amount of work. The clinicians are going to have to be trained, including myself. But I think ultimately it's going to serve us and our affiliate tremendously, as well as the other affiliates in California, as we're able to share data. We're able to not have to worry about charts that aren't missing, not have to worry about recent visits where we cannot find exactly what happened, or labs that are not in there. So it's going to be a extremely efficient system once we work through our methodology to get to the endpoint. So I think we're all anxious in some ways, and we're all worried, of course, how much time it's going to consume integrating this, but I think once we get there, we're all going to be happy with it.
We are not alone. There are about 15 of the 91 Planned Parenthood affiliates in this country who are currently on electronic health records. There are 5 of the large affiliates, including our neighbor Marmonte, as well as Planned Parenthood of Los Angeles and Planned Parenthood of San Diego, who are already up on electronic health records, the same system and the same format that we'll be using. So we have a lot of good advice from our other affiliates, and we look forward to sharing what we learn with the affiliates who come after us. So I hope that this video causes you to ask a lot of questions, because this is a big change for us and a very exciting one. And we really want to involve you and make sure that your questions are answered, and get your ideas and advice as we implement this over the course of time. So thank you very much.
Hi, I'm Phyllis Schoenwald, and I am the Vice President of Medical Services and also a Women's Health Physician Assistant. I'm here to tell you all of the wonderful things about electronic health records and why I'm excited to be part of this project. So one of the most exciting things that I've been part of for the last 2.5 years is the Clinical Quality Committee of NGHN. And what we've done over the last 2.5 years is to develop all of the templates, or the electronic health record forms, if you will, that we all will be using. So there's been a multitude of work done on all aspects of care. This will afford us great standardization and collection of data.
Hi, my name is Leslie Barron Johnson. I'm the Vice President of Client Services for Planned Parenthood Shasta Diablo. There's a lot of great benefits to EHR. In fact, at every staff meeting that we have, center management team meeting, we spend a lot of time working out systems that aren't working very well for us, and we think, oh, when we have EHR, we won't have to worry about that. I think it's really going to increase client and staff satisfaction, getting away from mundane tasks, filing, looking for charts, filing labs results, logging things, and being able to concentrate more on actually delivering services to our clients.
So my name is Andre LeBlanc, and I'm a reproductive health specialist here at Central Richmond. So here we are in the Central Richmond chart room. The problem is, a lot of times we can't find the record, so we spend a lot of time back here looking for charts that are misplaced or have disappeared. Oftentimes we're just digging through random piles looking for the correct chart. Actually, every time we fax something to another clinic, which is quite often, usually you're on the phone, you're working with clients at the front window and trying to balance that with faxing over the chart. In which case you have to get up, go to the chart room, look for that client's chart, bring it back, take out the documents you need, and then fax it over. And then in between everything else, find the time to put it back together in chronological order and then file it back where it's supposed to go. It takes a while. And this is why we need electronic health records.
I'm Debbie Bamberger. I'm the lead clinician at Central Richmond Planned Parenthood. My husband is a doctor who's the medical director of a clinic in the Tenderloin in San Francisco, and he implemented EMR in his site. And so he started it from scratch, and I just saw how great that was for his staff and his clinicians, and I just wished for that for myself.
Okay.
I have missing charts all the time. Yes.
And if one of your patients wants to go someplace else, how do you get their chart over there?
We fax it.
You fax a whole chart, or how many pages and pages and pages?
Many pages, or the pages we think they need, and then those turn out to not be the pages they need, and then we need more pages or less pages, and it's very time consuming.
And then do you ever see somebody else's patient from another center?
Yes, I do.
Yeah.
And sometimes I don't have the whole picture, and that makes it awkward when I'm talking to the patient because I don't know their whole story when I should, because they've been a patient in our affiliate before. Or there's something that's already been done that I didn't know that was done, or something that needs to have been done that I didn't know wasn't done.